Welcome to Health Talk. My name is Augusto Bastidas, and today we have Dr. Gloria Wu, who will be discussing for us age-related macular degeneration. Hello, Gloria.
Oh, thank you for having me on. We're going to talk about age-related macular degeneration, which is the leading cause of blindness over age 55.
Before we get started, I wanted to introduce you a little more.
Okay.
Dr. Wu is an ophthalmologist. She's a surgeon specializing in the surgery of the retina and the vitreous.
Oh, well, you know, it's fun to think about the retina and vitreous, and that's what I do all the time. And we have three leading causes of blindness. Number one is the leading cause of blindness of all ages is glaucoma. Number two, the leading cause of blindness between age 21 to 65 is diabetes. And the third one, the leading cause of blindness over age 55, is age-related macular degeneration. So here
Could you tell us a little bit about what each of those are? And I see you have a diagram of an eyeball here.
Yes, so here's the eye, and this is in cross-section, but here's the eye, and here we have the inside of the eye. So if we imagine the inside of the eye as we're standing inside like a cored-out cantaloupe. So we're standing inside the little orange part of the cantaloupe, the inside of the cantaloupe. Where we're standing dead center would be called the macula, where we would see. So the walls of the cantaloupe is towards the front part of your eye, the iris or the blue-colored part of your eyes, your brown part towards the lens. This is the area that you get retinal holes and retinal detachment. But where you're standing, where the core of the cantaloupe, that does the seeing, that gives you the 20/20 vision. So if you imagine we're inside this cantaloupe, inside our studio, where my feet are, this is the macula, this rug would be the macula, the Greek word meaning spot. That gives you 20/20 vision, the best color vision, you know, reds, the blues, the greens, and the yellows. So if anything happens in the macula, the rug where we're sitting, you know, right here where our feet are, that is the action in age-related macular degeneration. The stuff happens right there.
So in fact, when we actually look at something and see something, we're only using a very small part of the eye.
Right. So whenever we look towards the camera, both our eyes, the macula is lined up to the camera. So anywhere, if I'm looking at your red silk tie here, my macula is trained right on that. So this part is where it's going to be, you know, centered on the red tie, and this part is off to the side. So the macula has a lot of metabolic need for blood supply, for metabolism in order to see. And that's where all the stuff that goes on when we see a little flash of light in the dark, and our biochemistry tells us that's the carrots, the vitamin A. It changes the molecule from cis to trans, and that allows us the science of vision, so we see something. So in age-related macular degeneration, age plays a big role, because as we have more birthdays, we have hypertension or changes in our arteries. They get thickened or tortuous or curly, so the blood flow cannot go as smoothly. So the area of the macula gets less blood supply, and they think that there's degeneration going on, and the cells there die a little bit, and we start getting drusen, which are small little deposits, which I drew here in orange, that prevent you from seeing.
So macular degeneration is basically an injury to that area of the eye.
Right, in the macula.
And there are different things that can cause that injury, we believe.
Right, so they've isolated 5 causes. They think epidemiologically, looking at large population-based studies, 100,000 patients or 200,000 patients, they think that if you're a smoker, you have a higher rate of getting this disease earlier than age 55, when people think this is when it first begins. Or if you eat high glycemic index foods, 20% of age-related macular degeneration is thought to be caused by eating too much sugar, sweets, cake, stuff like that. And if you have excessive exposure to UV light. They did a study on the Chesapeake Bay fishermen, and they found out that those who were in the sun more hours than others had a higher incidence of having these yellow deposits all along the retina. So if you imagine the inside lining of the retina, the inside of the cantaloupe where we're standing, or this rug where we're standing, instead of being nice and flat, it's got big yellow oranges stuck on it. sticking up so that you can't walk on this smooth rug anymore. You have these bumps. So that means a little light array, a photon of light coming, won't be hitting a smooth surface. It's going to hit all this irregular surface. Then, instead of seeing a straight line as straight, it becomes wavy. So if you look in the newspaper and this is happening, the small print becomes wavy. Or if you're looking at the word apple pie is being served today, all the A's are wavy. Or if you're looking at yourself in the mirror, your nose is missing. Or if you look at your wife's nose or your husband's nose, it's missing. His whole face is clear, but the center part is missing.
So those are symptoms of what, to me, sounds like advanced degeneration. Is there a way to pick it up earlier?
Well, you would look at, everybody reads a newspaper every day or something like that. Cover one eye and look straight ahead at what would be the newspaper printing, not the headline, but something smaller. And if already one eye shows something wavy, then test your other eye, looking straight ahead. If something is wavy or there's a smudge, that's the earliest sign. So this is sort of like home examination, self-examination. Women
So I don't have to go to the eye doctor then?
No, you can just check yourself at home. No, just joking. But
no, it's important to get regular eye exams.
Of course.
Because I would imagine that this can be picked up earlier on a good retinal exam.
Yes, so it's important that people see a retinal specialist, somebody like myself who specialized, did 4 years of medical school, 4 years of ophthalmology, and extra training after ophthalmology to look at the retina, because we're really best equipped to look at this, because we have the machines and all the photographic equipment to look at this. Now, general ophthalmologists who do cataract surgery are good at this also. However, they may not be so interested in some of these symptoms because they're thinking about cataracts, because they think this is causing the decrease in vision, or the cornea, the front part of the eye. So we just look at the back, and sometimes they don't have our machines to really look at what's going on. So the incidence is 10 to 15 million people in America have age-related macular degeneration with decreased vision. An additional 7 million are at risk, meaning they have the yellow dots already along their retina, but not at their center. So for example, if here's the macula, you see 20/20 here, this part is smooth and okay, you could have great vision, pass the driving test, do the shooting range, be a pilot, but meanwhile you're getting these yellow dots elsewhere. And sometimes nobody's seeing that because grandma may have a cataract, so your general ophthalmologist may not even be able to see beyond, and they're thinking of something else that might be happening. So it's important that we see a ophthalmologist and a retinal specialist if you think this is going to be in, if you have a smudge in your line of view or something like that.
So this disease is age-related. So at what age should I be seeing a retinal specialist for a routine exam?
So starting for glaucoma testing, you should be screened at age 40, your first time seeing an ophthalmologist. But if you have anybody in your family with age-related macular degeneration, or if your mother or father at age 80 or 70 lost vision and cannot see somebody as soon as possible, because you want to be earlier rather than later. So usually once a year, they will give you something called an Amsler grid, which is basically black and white graph paper, which you would cover one eye and then cover the other eye to see if all the lines are up and down and straight, rather than wavy or missing spots.